I had no problems during the pregnancy. I wasn't high risk, I wasn't on bed rest. We had no problems. Birth, C-section goes okay. NICU doctor came in and said, she was a lot littler than her sister, and facial features were different. They were concerned that she had Down syndrome.
Yep.
And then they were like, she might have like a rare case of like dwarfism, just kind of picking her apart.
Yeah,
I immediately just kind of started bawling, and
that's a lot to take on. It's less than 8 hours after having twins, so. The frustrating thing is that all they were doing was guessing. 2 weeks after we brought her home, we probably went to the ER 2 or 3 times. Every time Reese tries to feed, all the formula was just kind of dumping into her lungs. They immediately schedule for the G-tube surgery so that we can feed her directly to her stomach.
When she was 9 months, she was still almost maybe a little bit more than her birth weight. I was like, I just feel like we're gonna lose her. Like there's something wrong to why she's not growing.
That was where we really made the decision. We need more help than what we're getting. It's a little over 2 hours to the Peyton Manning's Children's Hospital, but we're on our way down there to see them and just be checked in and hopefully get some answers.
She was admitted for almost 3 weeks, and that's when they started running all the tests. We were introduced to Dr. Escobar, who did a lot of genetic testing.
Fort Wayne had done some basic genetic testing, it was all normal. But we added testing for bone disorders, and we found a genetic change, that would explain everything that Reese was going through. All the complications is a symptom of the Larsen syndrome. I knew about Larsen syndrome, but through all my career, never found any other cases until Reese.
With Larsen's, they have a type of skeletal dysplasia. They have heart problems, they can have kidney problems, they can have developmental problems. Every case is different.
Things were starting to happen.
Yeah.
We were in such a stalemate where we were, and now we're starting to find things out.
So it kind of just made us feel a lot better because we kind of had an answer.
She's been doing great, and we'll plan on seeing her back in another few months.
Does that sound good to you, Reese?
I almost anticipate that whenever I walk into a room, that parents are going to be just as stressed or as more stressed than the child is.
Go see Dr. McKinney.
We can try to see them at different appointments at the same time and try to coordinate procedures, lab work, and all that kind of stuff to minimize visits as well as to minimize the stress from all the procedures that have to be done.
There is a critical need for the Pediatric Nurse Navigation Program to really walk alongside of our patients, like the Sollman family, who has had so many complex medical needs and will continue to be here. And we want to meet that need and take off that stress burden of who do I go to, what do I do? We want to give that support to our patients.
We've got 2 other kids at home that we've got to keep an eye on too. So it really helps to shorten the amount of times that we're driving back and forth.
We don't know families by numbers, but we know them by name. This is family, this is home, and we're here to take care of our patients.
There is always going to be worries and concerns, but I think Reese has a good chance of being okay for a long time.
She has gone from not being able to taste food at all. Now she will eat anything in sight. We've started getting the answers. We continue to do the things that the doctors tell us that we need to do to continue her improvement. Again, as a parent, that's all you want. You want to see her grow, you want to see her thrive, you want to see her do great things in life. And so I think the best way for that to happen is to continue making that 2-hour drive.